Mike, goods are scarce
people
in socialism, but not in capitalism. The great thing about capitalism is you have more goods created.
Well, my good buddy Quentin needs to read the dictionary. By definition, you cannot have rationing where you have a pricing distribution system where the provider of insurance and that person receiving the service agree in a written contract what the cost is going to be and what the service is going to be. You can only have rationing in an ad hoc system with no written contract, which is what Obama wants.
Mike?
You know, your private health insurance...
Hold on, Quentin. Mike Maiello, go ahead.
Your private health insurance company has a commission within it, right, of people you don't know who they are, who are making decisions about what that insurance company will and will not cover, and they can get between you and your doctor. Right now, my wife, she had a knee injury, right? Her doctor said physical therapy will fix it. The insurance company disagreed. So we had to have a big argument about it.
The question is whether you're going to have more of it under a nationalized health care. You can't add 31 million more people to a health care system with a finite number of doctors, nurses, and hospitals without having more rationing.
Yeah, we don't have real free enterprise in health care today, David. We have it in parts of it, but that's the reason why you don't get increased supply of health care. That's what you want, not rationing what exists, but having more of a supply of health care. And governments never are able to do that. And that's why you start by having competition on insurance. Where I live in New Jersey, family policy costs $15,000. Go to Pennsylvania, get a similar policy for $7,000. Get nationwide competition.
EMAC. All right, and by the way, ignore what the Congress is putting in health reform now, because Medicare has been tinkered with virtually every year since it was passed in the mid-'60s. Who cares that they're saying they're not going to ration care? Look, when they set down any kind of guidelines, by the way, the federal, health board that's being talked about, the comparative effectiveness research
commission.
Advisory, right? It is advisory. They're saying they're not going to regulate, but watch this: private insurers follow. Private insurers will follow their decision making. That leads to more rationing. That's what will happen.
Neil, when you look at your insurance company, they always have recommended procedures and non-recommended, and they don't pay for the non-recommended procedures. So if these commissions make reports, it's going to affect the care we get.
No, our health care companies right now are rationing our care, as Mike mentioned. But the other thing I'd say, David, is, I mean, there's frankly a little bit of absurdity to your argument. You're saying, we have to ration because we're going to be giving this health care to 31 million additional people. The fact of the matter is those people are rationed to zero right now. So to them, this sort of rationing where they might not get some Cadillac treatment doesn't sound so bad.
They go to emergency rooms and get health care from hospitals. They're not rationed to zero.
It's inefficient delivery of health care, but anyone who goes to an emergency room, you will be cared for.
Well, not only emergency room, Mike, my wife was in a beautiful room up at one of the hospitals in New York with a view of the river. She was sharing that room with a homeless woman.
That's right, and the only way to eliminate any form of rationing, really, is to go to a free market pricing system. Look at cosmetic eye surgery, where technology is advanced and the supply has gone up, lowering price. That's what we need.
Key. Getting increased supply. Entrepreneurs can do it. Bureaucrats cannot.
But what about also bringing some sunshine to this process? Because if there is a commission and it is making recommendations, like the kind of boneheaded commission did last week about mammograms, right? That was an unpopular recommendation. They have been held up to ridicule, and their advice will not be taken. Why? Because people won't stand for it.
You already have, though, in the system MedPAC, and it's that's what oversees the Medicare advisory panel. But I'm not for a rationing college of cardinals where these high priests of medicine can decide who gets care and who doesn't, just by these hand-fisted force of their politics and not free market principles. I got to say, Steve and Mike are absolutely right.
Quinn, go ahead.
I think Steve and Liz are remarkably non-free market here. You seem to think when you go to an emergency room, that cost doesn't appear anywhere.
I'm not saying
rationing exists. Well, you are. You're going to say these 15% of people who get zero, they'll just go to an emergency room.
No, we're not saying that. You're distorting the argument, Quentin, as usual. You're distorting what Steve and I said.
Hold on, one at a time, one at a time.
You're not approaching this as a rational problem. I felt very sorry for that man.
Steve, how do you feel about this? Do you think we're following a rational kind of thought process?
Studying the problem, made recommendations. Can I finish?
Finish quickly, and then we'll get Stephen. Go ahead, Quentin.
People study this problem and make recommendations, and the Republicans throw up their hands and the Democrats run away from it. You've actually got to think through the problem and listen to experts.
Steve.
I'm sorry.
The bottom line is you want more health care, allow true entrepreneurship in health care, starting with health insurance, and you will get more of a supply. Like as Mike says, you do with cosmetic surgery, LASIK surgery for the eyes, we'll have more for less.
Point is, goods are not scarce in a free market if we get a free market. All right, guys. Well,